Welcome to the Business Growth Spotlight, where we shine the light and talk with business leaders from all over the world who are here sharing their expertise and wisdom so we can all grow together. I'm your host, Heidi Schalk, co-founder of HLH Growth Solutions, where we help businesses grow and scale through outside-the-box visibility and automation strategies. If you're new to the podcast and just joining us today, welcome. I'm so happy to have you here. You're in for a real treat in this conversation today. Please stay to the end because I have a special gift for you. But without further ado, I want to introduce you to my special guest today, Jeff Petersen with Petersen Physical Therapy. So welcome, Jeff, to the podcast.
Hey, thank you, Heidi. It's good to be here.
It's great to chat with you. So, Jeff, can you kick us off and share with us a little bit about yourself, about Petersen Physical Therapy, and your role within it?
Yeah. So I'm one of the old guard of physical therapy. I saw the American Physical Therapy Association in 2020. The keynote address was done by the president of the American Physical Therapy Association. And as I was listening to her describe the profession, kind of became a real profession in the mid 70s. I graduated in 84. I've worked through about 3/4 of the profession as a profession. You know, when I became a therapist, no one even knew what it was. And now the awareness has really grown. So I've been practicing for 42 years. I've owned my own business for 35 years and have just seen, when we started practicing, we literally took the appointments with a pencil on a paper appointment book that we used to have to purchase specially, have it printed out. And we use what was called a pegboard billing system.
Okay.
And it was a huge board where you could keep track of people's accounts as they grew. You'd have to flip another page over. I wish I did because it would be perfect in a museum. You know, that stuff got all taught. We're totally old school.
It would be so fun to see that back there.
Yeah, totally. So, and the profession has grown too in terms of what we can do. So I'm excited because I get to work with some young therapists now, and it's good to teach them some stuff. And it's awesome for me to learn from them in terms of what they just have learned in terms of the new science. But we've been practicing I've been practicing 42 years, own business 35. We do mostly outpatient orthopedics, but we do have an office that does exclusively neuro rehab, which is closed head injuries, spinal cord injuries, strokes, anything that involves the brain or the central nervous system. And right now we have 4 offices, and I live in Arizona, so we have those basically in and around Phoenix, and it's a great job. You know, I got into it because a 5th grade teacher said, you should be a physical therapist.
Really? He saw your talent way back, or he or she saw your talent way back then, huh?
Well, he kind of took a couple of us. He took a couple of us under his wing that, you know, were little miscreants that showed at least some measure of something that he saw. And I think it was to keep us out of trouble. I wanted to be a roofer because back in Mass, I come from Boston originally. And to be a roofer, you made $5 an hour. They were always tan, all the beer they could drink on Friday afternoon. And every year they went to Florida in the wintertime because they couldn't work. And I thought, that is my life. And I'll never forget what he said, because he was asking me, so what do you want to do? And so I was describing that as the perfect job. And he said, you know, your back is going to give out on you sooner than your brain. So you might want to consider a job that you use your brain. And for some reason that clicked with me. I was like, yeah, that makes some sense. And then he said, well, have you considered physical therapy? And again, I didn't know what it was in 1977. And so he showed me a statistic, and the unemployment rate for physical therapists was 0. And you could make $19,000 a year. And I thought, sign me up. I'm ready to do it. So I went in, unlike the young people of today who are goal-oriented, who know what they want to do. I kind of fell into the profession, and I think it was an act of God because I love what I do. I have a great life. I have awesome family, and a lot of it was produced through working, helping people. So that's kind of my history.
Yeah, well, it's amazing. And you created everything you've created. So he just got to be in the place to support you in opening your eyes to what's possible, right?
Yeah, totally.
And what a great teacher you had, right?
Yeah, you know, you never know when you see a little kid run around, and little boys, you know, they want to break things. I had a bunch of brothers, and we were like a pack of wild dogs, and You see these little kids that are acting up nowadays. They want to corral them and say, okay, now play right, don't be too rough. And my wife grew up with sisters, so she'll see little boys going, and I always chuckle and say, yeah, see that dirty little kid that's all scruffy, you never know what's gonna happen with that kid's life. So it's okay.
I love
So
it.
the good news is today you said something about me building it all. The truth is it really is about building the team. So
Yeah.
it took me a little while to kind of disabuse myself of the idea that if it's up to me, if it's going to be, it's up to me. The truth is, it really is about what can I do to contribute to coalesce a team of people and access their talents where they're participating, but they're also growing and succeeding in areas that they want to succeed in their life. And that's what has sustained me for 35 years, honestly.
Yeah.
Uh,
And I love that. I want to dive into that as we move forward, is the culture that you're
Absolutely.
creating, and you've really what's the word I'm looking for? Enriched, but I don't know if that's the right word, but that you've cultivated inside of your company, which is really important in growing a successful business. And not only do you have one offices, but multiple offices. But before we dive into that growth piece of it, I want to talk more about you and your company and in what you do. So let's talk about pain a little bit. So a lot of us experience pain. Pain affects millions of people every day. I'm getting older, and so Jeff, I was sitting in my chair and got up like probably 2 hours ago, and I went to walk across you can see my living room behind me. I literally went to walk across, and I'm like my hips are like crouched down, my knees are bent,
Yeah.
my body is walking. So pain affects all of us in different ways. So yet
Yes.
so many people, we struggle with, finding lasting solutions or what to do. So why do you think pain is so misunderstood in today's healthcare system?
That's a great question. I think it's misunderstood because it's characterized as something bad. So it's either characterized as something bad that is to be avoided at all costs. And if you're in pain, the goal is to get rid of it. And I certainly understand that. I've experienced pain physically. I just am recovering from a torn rotator cuff. I had a torn meniscus, but it's not bad morally. The other thing is it's not a very good warning system because pain comes after the problem is there. It's more like the on your dash, the check engine light. It does tell you, yeah, something may be wrong. Now, interestingly, you may also have pain when nothing is wrong. You've heard of phantom limb pain. So if people have had an amputation, traumatic, or because of a diabetic ulcer on the foot, and they had pain in their foot for years, and the tissue is dying, and they have to do an amputation. Sometimes the brain gets so efficient at registering the pain that it doesn't go away, and they can feel pain in their foot even though they don't have a foot. And that's because all pain is centered in our brain. The guys who do nothing, the International Association for the Study of Pain, define pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. So you don't even have to have tissue damage to have pain. It's just a matter of those nerves firing very efficiently. So, and what brings people to us is pain. The pain gets so great, they need to change. And that often motivates people. I mean, most people are motivated by the avoidance of pain. That's how we train little kids sometimes. If you do this, you'll be in trouble. So I think the thing that I've learned the most in 42 years is emotional pain and physical pain are exactly the same thing. Whether your dog dies, which is terrible, or you break your toe, the only difference is how your brain interprets it. So our interpretation of the pain we're experiencing can be really impactful. When I first hurt my rotator cuff, I would lie in bed and I was tempted to catastrophize it, which is, oh my gosh, oh my gosh, oh my God, I wish it didn't hurt. I'm trying to avoid it. I finally had to just kind of center my mind and focus on it and say, okay, I can kind of feel it's one area, so let me find a position that's comfortable and I'm going to be okay. So mindset is so important. There's an orthopedic surgeon who did research, and he can predict the results of a total knee replacement based upon the pre-surgical mindset of the patient. Because when you have a knee replacement, it hurts.
Yeah.
To recover from it, it's not an uncomfortable thing. So the way I phrase it, and this is something that came out of my own life, is that the first thing you want to do is you need to know yourself. Okay, how much do I move? How good's my balance? What is my body type? Am I active? Am I not active? About 5 years ago, I was having back pain, and I was just griping to my wife. She said, "Well, what would you tell patients?" So I stripped down and stood in front of the mirror, and I was that guy with a big belly and no butt. Now, we're all good guys. We are good guys. I golf with a bunch of guys like that. We are good guys. I'm not criticizing us, but we all have back and hip pain because of the imbalance and no glutes and the imbalance from having too much weight in this front area. So to be able to look at yourself honestly and say, okay, what do I have going for me? What are my tendencies towards weakness? We work with a lot of people that have what's called hypermobility. Their joints, and you see these people. When I was a kid, they called it double jointed. The kid who could fold his fingers over and bend his fingers back and do the splits. And now we realize that some of that can get to the point where it's pathological because joints have an optimal amount of mobility, and too much mobility is going to lead to hypermobility, can be problematic. Not enough, you're going to be stiff and not move and get the nutrition you need. So there really is an optimal amount of mobility. So it's really important to be able to just assess yourself first. Identify how did the injury occur, when does it hurt, what can't I do? One of the things that drives me crazy is everywhere you go, they say, rate your pain on a scale of 1 to 10. Well, that's a numerical scale, and not everybody thinks in numbers. So I always try to reorient to say, let's rate it in terms of what's it costing you functionally? What can't you do? And then the next thing is to take control over what you can control. People want to control the world around them, and they'll show up, and the most challenging patient are the patient who shows up and say, fix me. But they're not willing to say, okay, well, how much of this is in your control? So I had a procedure on my shoulder. It's called PRP. It's platelet-rich plasma, where they draw your blood and they spin it down, and the platelets are the cells that help glue tissue together. And then he injected into my shoulder. Well, he's creating inflammation, and it really hurts. And that first week, I knew I had an injury in my shoulder, but I can't tell you how many times I would reach out and do something really silly to irritate my shoulder. And I should know better. I've been a therapist for 42 years. I've told people, don't reach in your back seat from the car because that's going to strain your rotator cuff. But I found myself still doing it. And I had to, again, to know myself, I had to realize I'm really rough on things. I break dishes when I wash them. I dent my car when I'm pulling into the parking lot. I had to just not criticize myself and say, I need to slow down and be more intentional about how I'm moving my upper extremity on the right because there's an injury there and I want to rest it. And then, of course, control also involves, okay, do what you can do. Exercise, make sure your nutrition is good, making sure you're resting, make sure you're resting in the right posture. Posture is key. And make sure you're moving. What you described earlier about getting up and your knees being stiff, our body's joints lubricate themselves with movement. So movement is key. Well, when you're in pain, you don't feel like moving. I don't. I want to lay there and moan and groan and feel sorry for myself. But movement is the key. So to get moving, do the exercise you need. And I think the last thing in the area of self-control is to seek help when necessary.
Yeah.
Sometimes people are hesitant to ask for help when they're in pain. It's true emotionally, it's true physically. So to find trusted people that you can say, will you look at this and tell me how serious this is? Because it's a set of eyes that's objective. For my shoulder, I went to see somebody. I knew it was the supraspinatus because I had been working it, but I have 42 years of experience. Not many people do. So the idea is go see someone that can help you identify the severity of it, let you know where you're at in the stage of healing and kind of move you along. And then the final thing really is, can you give of yourself to someone else?
Yeah.
When you're in pain, particularly for people who are in chronic pain or chronic dysfunction, they want to be isolated. They want to be alone. You can go ask for help for people to serve you and help you. But if you don't get to the point where you're willing to put yourself out there and engage with other people in a helpful way, you're not going to ever get through that pain. Like I said, whether it's an emotional loss or a serious physical injury. So that's kind of the process that I have kind of outlined for dealing with pain. The process is the same. It works. It works if you, especially if you have help and you're intentional about it, but you don't have to just live and suffer forever. Some pains you can get treatment, it goes away. There are some pains that never go away, and nobody gets out of life without some pain. Life is a painful experience, even if it's just emotional pain. But even physically, life is a painful experience. And so I've always tried to help patients. If you can identify a process to deal with it, then you at least have some hope that I can keep moving forward and find purpose and hope in my life. And it's not going to ruin my life. It's going to enhance it.
Yeah. You said so many good things there. A few things I pulled out. I listened to all, but a few things I really I pulled out was one, which is minor in the whole scheme of everything you said, but it really stood out to me is, really numbering your pain from 1 to 10, because someone's 10 could be somebody else's 3.
Totally.
So I get where I love how you do it. And you are like, okay, let's figure out what level you're at, because it differentiates between putting a number, because I know I have a high tolerance for pain, but somebody else, maybe that's a 10. So
Yes.
for doctors to really like, or therapists to really like, okay, gauge it on that. What's a 10 for someone else, and how to handle that for one person is not the same as how they're going to treat it for someone else.
Exactly right. And the only reason we do that is because the insurance company wants us to document it.
Right.
And about 15 years ago, the AMA decided that pain was going to be the 5th vital sign, which was helpful in that they wanted to recognize pain. Back in the day, physicians weren't as responsive to people's pain, but the pendulum switched to the point where it's not an objective measure of the severity of the problem. The intensity of one's pain is rarely associated with the severity of one's problem. So many of the problems that are not life-threatening are the most painful. Yet many of the things that are life-threatening, pancreatic cancer, I can think of, brain tumors, they're rarely very painful.
Exactly. My sister-in-law, my children's dad's sister, had a brain tumor right coming out of high school, before she left for college. And the only reason that the doctor even knew of it was because they had found her outside the screen door. And the doctor said, "How did you get the bruise down your arm?" And she goes, "What bruise?" She didn't feel it. She didn't know it was there. He goes, "You don't know you didn't feel this?" And she said, "No."
Yeah.
And they immediately took her in, and she had a brain tumor. So yeah, I love that you brought that up. And so I'm really glad that we touched on this, because there's people listening that are be like, wait a minute, the severity of pain is not necessarily the severity of the challenge or issue you're having medically. So
Absolutely.
thank you for bringing
Absolutely.
light to that,
Yeah.
because
If you look at if you've ever known anyone who has had shingles, shingles are intense in the level of
I have
pain they
heard.
cause. Yet shingles aren't going to kill you,
Yeah.
but they will make you want to die.
Yeah.
So it's helpful for the mindset to appreciate that, okay, the pain is intense, but it doesn't mean it's a severe problem. It doesn't mean you ignore it. And that scale, like with your sister-in-law, the idea is to measure function. If pain is keeping someone up at night, that's the first thing I want to know, because that's the best goal. If we can get you to sleep well, you're well rested, you're better able to deal with the pain. So let's do what we can do to get you to be able to sleep well. Okay, what's your next goal? I want to be able to go up and down the stairs. I want to be able to play with my grandkids. Those are all worthy goals. But the first one I'm going to work on with people is, let's get you to the point where you can sleep, because
Yeah.
that's going to help. That's going to make the whole world look better.
Yeah. And what you said too is like, you just need to be moving. A lot of pain is just a matter of your joints get stiff. It's just a matter of moving. In today's day and age, with work and so much remote working, we can sit here for 8-10 hours and not move. Sometimes we skip lunch. I'll talk about myself, and we're just sitting here getting the thing done. And then we go to get up. And then after so long of doing that, and even if the next day you might be sitting for an hour, your body is now locked in because it thinks it's sitting there for 8 to 10 hours, right?
Absolutely.
And that movement is going to get those joints lubricated. And just like anything in business, momentum creates action. Action creates clarity. Same thing with your body. Getting moving,
Absolutely.
taking that action is going to keep everything functioning where it should be. Because I know the pain and stiffness I was feeling isn't anything serious. It was
Yes.
hurting. And I was like,
Yes.
oh my gosh, but it wasn't anything serious. It's just like, okay,
No,
Heidi, you got to get moving your body more.
absolutely. And that kind of awareness is awesome. And then on the other hand, so we treat people that have a condition called Ehlers-Danlos. And Ehlers-Danlos is a pathological hypermobility of tissue. The building blocks of our tissue is collagen cells. They're like the bricks that put everything together. And for some reason, and there's several different types, about 15 different types, and they get really severe. The tissue just it's not as tight as it could be. And those people have pain if they move in ways that is not safe. They need help with braces, maybe some tape. But sometimes, and sometimes it affects the tissue in the heart and the aorta and the blood vessels so that they'll pass out if they stand up and move too
Oh,
much.
wow.
Because the blood vessel, normally what happens is when my heart pumps, it stretches that aorta and it sends a signal to my brain, okay, there's blood coming. And as the more I work, the more blood I get and my heart rate goes up. But even with patients like that, we say, no, you've got to move. So let's start you moving in a recumbent position first. And then we'll work you to a sitting position and moving. Then we'll work to a standing position moving. Now, it takes a lot longer, but the principle is exactly the same. The parameters change depending upon the condition, but the principle is exactly the same.
Mm. So, what are some of the biggest mistakes you've seen people make? And I know you've gone through a lot of what we should be doing and how to keep pain free or moving through pain and what the pain levels mean. But what are some of the biggest mistakes you're seeing people make when trying to manage or eliminate chronic pain?
I think the biggest thing is probably chase the quick fix for one, not being clear on who they are in terms of what they have going well for them, what their resources are. And then when they do start moving, oftentimes, and I'll speak for myself, when I was having hip and back pain, I knew I needed to get some flexibility, get some strength. So I need to build my glutes. You see all the old guys with, the flat butts, the pants are falling off, not because it's a fashion statement. It's because they have
Us
nothing to
women
hold them up.
too, we're there too.
Yeah, totally. So we have a local gym and I like working out in the gym because it motivates me more than home, but I do work out at home too. And they have a glute machine. It's to do bridges. And this 20-something-year-old fit little girl, and I don't mean that in a pejorative way, but to me, could have been my daughter or younger. And she had a couple plates on there and she's, starts taking them off. And I'm like, no, don't worry about it. I can do that. And it was way too much weight, way too much. I come home, my wife's like, well, were you showing off? I was like, I wasn't trying to show off. I was overestimating my ability. So the biggest issue when people do start to move and exercise on their own, exercise is intensity of exercise, frequency, how often, duration, how long you're exercising. The biggest mistake people make when they start an exercise program is the intensity is too high.
Yes.
So the key is to increase the frequency. Let's do it more often. Let's lower the intensity, but challenging enough that you feel like you're working, challenging enough that you feel like, okay, I did something yesterday, but not so challenging that you reproduce the symptoms that you're having. And that's where sometimes it's okay to go and ask someone to help you do that. So that's probably the biggest mistake.
Yeah. How many of you listening have gone oh, I'm going to start my exercise routine today. And then 3 days later, you can't move because, right. Because we've overestimated, we've overexerted, and we think we can handle, and our body could handle it in the moment, but we haven't done anything. And gosh knows how long. We're moving muscles we haven't moved, or working them out in different ways we haven't worked them out. So take it easy. Don't overestimate. So Jeff, you built.
And I will mention one other mistake. So let's say you're doing that and you're consistent. And I've seen a lot of older people that they have done the same routine for years.
Right.
So for the people who are fit and doing stuff, it's also important to change it up a little bit. The fact is we need to be challenged to change. Right. And so it's true of our bodies, it's true of our hearts, it's true of our emotions. And so the last mistake, that it's less common, but to do the same thing because they've gotten into a habit. Okay, I do this every day. And it's good that they're exercising every day, but it's also important to kind of change it up a little bit so you challenge the system.
Yeah, work them in different ways. If you're exercising, it's important because just like our brains we want to grow. And in order to grow, mentally, spiritually, physically. We have to change things up. Otherwise, we're going to
Yes.
stay stagnant, and same thing with your body. So great
Yeah.
point. Thank you for that reminder. So Jeff, you built Petersen Physical Therapy around helping people regain their quality of life. What makes your approach or your practice different from traditional physical therapy models?
I would say what differentiates us is the culture that we've created. So our promise at our office is with unconditional positive regard. So we don't judge people who are in pain. I've seen that for decades where if a patient doesn't respond, one of the jokes I will tell a patient after I've evaluated and we set their goals, and I'll say, and the good news is you do all the work and I'll take all the credit. And that joke comes out of seeing physicians and surgeons. If a surgery doesn't go well, they immediately blame the patient. Well, what'd you do? Or they blame the therapist. So with unconditional positive regard, I'm not judging how I think someone should respond to a torn rotator cuff or to a total hip replacement. I'm not comparing one patient to another. I look at my wife, she's doing great. Well, she has a therapist living with her who's been a therapist for 42 years, who I've been coaching her for at least a year before her hip replacement. And so she has some resources that not everybody has. Then the other thing is, so unconditional policy, we meet them where they are and help them move one step forward. Now, when I first became a therapist, my idea was I'm going to be healing people. So it's up to me. I'm going to heal them. I'm going to do some manual therapy, manipulation, exercise, and we're going to get them moving. And that was a fool's errand because people are really complex. So I've adopted the approach. If we can help somebody take one step, then the next step is a little bit easier. So we try to keep 2 steps in mind, but take the next step. And then 2 steps in mind, take the next step. And next thing you know, you're walking and running down the street. So we really have tried to do that in an environment that is non-judgmental, encouraging, and highly competent. So to get all that together, it's like finding the perfect woman. For my sake, I don't know.
Or man.
So yeah. So we just have a really good team, and the people we hire are kind of on board with that. They're on board with, okay, this is a team. I have my role, and I need to do my job really well so that we can help people move forward.
Yeah, and I like that you shared. I love that you shared the mental piece. Like you are creating a positive environment because I'm sure people in pain, they're already feeling like, nervous. They're in pain, so they're already probably a little bit on guard in providing that no judgment, that because we compare ourselves to others. So if somebody
Yes.
else sees somebody in your place with a hip replacement and they're like literally in and out of there in 6 weeks, and they're like, oh, wait a minute, I've been here 8 weeks. What's wrong with me? I love that you're creating that because like you shared with the other and what you mentioned earlier, you've mentioned a doctor that knows based on how they walk in and their mental state, how fast they're going to recover. We
Absolutely.
don't, as patients, I think it's a good reminder to know our mentals, I'll say strength for lack of a better word, but mental strength is just as important to our recovery as.
Absolutely. Absolutely. The mindset around pain is really important. And we have people compare all the time. And I always joke, I have 2 daughters and they would compare to each other. So I always say, if it's a female, I say, ladies, I'll tell you what I tell my daughters, you don't compare to other girls. And that kind of softens the mood, but they will. Hey, when did you have your surgery?
Right.
When did you? Or my uncle had a knee replacement. It's like, well, we don't know what was going on with your uncle. They're all different. There are some parameters that we expect. And so, but it's a pretty broad guideline and it's a pretty wide road that we can be on when we recover from stuff. It depends on what was going on beforehand, what was going on with the tissue, what's going on at home. So yeah, we don't compare. Everybody's an individual and they go at their own pace.
Yeah. Well, you have a book and I want to
Yes.
dive into that. So it's called Shadow of Pain, which is so
Yes.
cool. And that's a powerful title. So what inspired you, Jeff, to write the book, and what message did you want your readers to walk away with?
So it's basically a summary of the conversation that I've been having for 42 years, with patients that are in pain. It's a refined version 42 years later, but it's been in development for 42 years of working with people that are physically impaired, that have pain, that are seeking relief from their pain. And we've helped a lot of people eliminate pain in certain areas, but you'd be amazed at how many people keep coming back. So they have pain in one area, then they come back in another area, come back in another area. So no one gets out without pain. So that's one of the messages. The other message is there is a process to shape your thinking and your mindset around pain. The idea of knowing yourself. If your pain is caused by falls, or you had a knee replacement because it's worn out, and you don't know your balance, we do a single leg stand test with people. And people are like, oh, wow, I've never done that. I've never tried that. I've never thought of that. Well, your ability to stand on one leg is a pretty strong determiner of what your balance is and how safe you're going to be walking, particularly as you get older, or if you're recovering from an injury. So when I say know yourself, self-awareness has always been in the realm of emotional self-awareness. And I think there's a corollary to physical or kinesthetic awareness. And they're intimately linked. Just like pain is an emotional and a physical response, self-awareness is an emotional and a kinesthetic response. So the first thing is know where you're starting. Know where your activity level is, know where your strength is, your flexibility, where your weaknesses are, where your strength is. And that's the first part. Are hesitant to do that because it's perceived as self-judgment or criticism. My wife will look in the mirror and she'll see all her defects. I look in
We
the
do
mirror, I'm
that
like,
as
yeah.
women. We tend to
I'm
do
like,
that.
yeah, I'm a little pudgy here, but I know there's something, there's Superman in there. I just need a couple weeks in the gym. He'll be back. It's a different mindset. And so to kind of work through that, and also to understand that pain is not a punishment for anything. Yes, I tore my own rotator cuff, but I don't need to beat myself up for that. I need to look at it and say, okay, what happened? How did I do it? How can I exercise some measure of self-control to work through it? And then I think the greatest message is to say, even in the midst of our pain, there is a process to work through it, but the ultimate goal should be, how can I reach out to the world around me and serve someone else? Because that's really where purpose is found. And the saddest thing I've seen is people that are in so much pain, they just give up, and they give up on their purpose in life because it's all they can do to endure their pain.
Yeah.
Ironically, laying around taking medicine and not moving is the worst thing you can do for any pain. I don't care what the cause of it is. So that's kind of the message of the book. There is hope in there. And then I do include some practical stuff at the end, but it's more of a book of, okay, how do you work through this in a way that you can do it at home and you can find hope and some meaning in your life again?
Yeah. So good. Well, where can we find it and get it?
It's we're going to do the pre-launch in July.
Oh,
So it's
beautiful. So
still,
it's coming out.
I just sent it into production, and so the writing is done, the editing is done, which was about a year of writing and editing.
Well, congratulations. So if you're listening to this and we're in July, because we're recording in May, so that we could
Okay.
be on the same timeline that when this comes out. So depending on when this is launching, this is airing, either go grab it or
Sure.
stay tuned. And we're going to share with you toward as we get closer to wrapping up how you can connect with Jeff and learn more
Yeah, and you
about
can just
how
go
to
to our
stay.
website. So
Yeah. Perfect. And we're going to have all that information for you on the show notes. And we'll be definitely promoting it a lot toward the end of this conversation.
thank
So
you.
Jeff, I want to move a little bit into growth of your business because you have four.
Yes.
You've been in business for over 30 years. You obviously are doing something right. So how are you staying in front of people who need your services? How are they finding you?
Yeah, that's a
What
good
have you
question.
done marketing visibility wise? And I'm
So,
sure it's shifted over the years.
oh, totally. So back in the day, it was knocking on the door. When I started my practice, I literally would pick up the phone, call doctors and say, send me your worst patients, send me the patients you don't like, send me the patients that aren't getting better, give me a chance. So it was knocking on the door, begging for referrals. And we did that for at least a decade. And yellow pages and word of mouth is a big one. And then obviously, next thing you know, people say, well, you need a website. And I'll never forget, this is probably 1994, 95. I can't remember the exact year, but it was pretty early, in the computer age. And I thought, why on earth would we want a website? Like, why do we need to spend the money to get a website? At the time, we were probably spending $1,200 a month on a Yellow Page ad. Now, many of your listeners may not know what the Yellow Pages is, but we used
I
to get a
remember.
book that was
Yeah.
this thick every year, and we had to pay to be in there, and you could get a little bit of an ad or a big ad. And, we were like, oh my gosh, should we change our name to AAA Physical Therapy so we're the first one in there?
Right.
Uh, and so that changed. So a lot of it is it's still kind of face to face. Or my brother was a salesman. He says he's a little bit bigger than me. He says belly to belly sales. So that's always the best way to sell. And that's what we're doing. We're selling our services, say, hey, try us out. Right now, we get a lot of our referrals because people know us because we've been around forever.
Yeah.
But we have moved into, online sales in terms of not selling online, but promotions with trying to give people some stuff that we have, some information. So we have a YouTube channel and we send out a newsletter, and we have a digital newsletter that we send out, and we email people. And then this is a new part to say, okay, podcasting is becoming part of it. So I don't know. I don't know the value of that. I remember back in the day when we were paying for Yellow Pages and we had a couple ads, the expression was 95% of your advertising budget is wasted. The only challenge is you don't know what 5% is producing.
Yeah.
But we are getting, we used to get 99% of our referrals, new patients from referrals from doctors. Then it was about 90-10. The patients came because they were referred by other patients. Now it's probably 75% referrals from doctors, maybe even less, where the physician will say, you need physical therapy. Here's a referral. You go find someone close to your home. And then people will get online and Google physical therapy in Tempe near me. And hopefully we pop up, and they go, oh yeah, I know that name, or so-and-so told me about that name. And that's how they find us. So really people finding us online has increased dramatically.
And now you have
Absolutely.
your book. So I can imagine for that piece of it, I know, because I know do you do a lot of telemed where you've branched out with like the
We
evolution
tried,
of that, or is it more local?
we tried telemed during COVID,
Mhm.
but the truth is, the other part of what we do is we touch every patient that comes in.
Yeah.
So
Okay.
we get our hands on people because it's the best way to kind of figure out what's going on with them emotionally and physically. And so we couldn't reproduce that
Right.
with telemed. I just had a telemed appointment with my doctor, but we were going over, here's your
Right.
blood work, here's what you need, how's everything going?
Right.
And I would foresee a day where more medicine is remote. My wife had a hip replacement. The robot did most of the surgery.
Wow.
So I could imagine you get online and you talk to your doctor, and he uploads, the system uploads some films. They check it out, they schedule for the surgery, and the robot does the whole surgery.
Mm.
So that, as wild as that seems, that day is coming,
Oh,
you
yeah.
know.
It's already here in some
Yes.
instances, just like you shared. So, yeah.
Yeah.
But like you
So,
said, what you do, it has to be hands on.
people need connection.
Yeah.
People need to be touched. People need, my shoulder was hurt. My wife's not a therapist, but she was just gently rubbing it. I was like,
Yeah.
thank you.
Yeah.
Thank you. And she had no clinical skills. She was just trying to be affectionate. But I could feel my shoulder getting warm, and I could feel it like, okay, that's perfect right there. So we do need to have, we're still a pretty high touch business.
Yeah.
And that won't go away soon.
For sure. So we talked about, pain. We've talked about your book. We've talked about what the mistakes people are making and how they can better serve, recover from or move through their pain. We talked a little bit about growth. I'm curious about with your four offices that you have. That's a lot to run, right? And
Yeah.
we talked a little bit about the culture, and you are very intentional on creating a really cohesive culture inside of your business, which is obvious because of what you shared when we first started this conversation, which was I'm nothing without my team. And not so in for lack of saying it word for word, but basically
Yeah.
you're like, it's not just me. I didn't build this
Absolutely.
alone. I built it with my team, and they're really important, in order to take care of all your patients and so forth. how are you managing that as far as the day to day? We have so much happening now with efficiency and advancements in technology. You mentioned the robot working on your wife for her surgery. There's so many things coming with AI that have already come, right?
Sure.
And now it seems like it's evolving and changing all the time. 2 months from now, 2 months ago, AI looked a little different than it does today. And 2 months from now, it's going to be advanced so much even further. So how are you utilizing it, not utilizing it? Are you using it in any way to support your business and your team?
Yeah, so there was two questions in there. I'll answer the first one first. How do I manage it? And the way I describe it to my team is we don't do what we do for the numbers. But I didn't really start to have success in the business until I got a handle on the numbers. And the first numbers obviously are how much money's coming in and how much money's going out. But how much money coming in and how much money going out, those are lagging indicators of my success. That the finances that come in represent activity from the past. So probably the greatest shift I made years ago, decades ago, was to start to look at the activity and the results from activity earlier on. And economists call it the leading indicators. Okay. How many new patients? Well, how many contacts to referral sources? How many new patients are calling in? How many new patients are we seeing? What's our percent arrivals? So kind of monitoring those numbers as a measure of what's going to happen in the future allowed me to plan to say, okay, we're having a really strong time here. We know that we're getting the visits in. We know the collections are going to follow. So getting a handle on those numbers is really important. And then the other way what I think I bring to the team is the ability to look forward and have a vision for what we might do and what we might be able to eliminate and create more efficiency. Now, the challenge is our business is a high relationship with the staff and the team, relationship with the patients, relationship with the referral sources. And I've learned you got to be real careful to build efficiency into relationships because relationships are not usually efficient. So being selective about, okay, what relationships do I want to build and let them build and let them build? It's like the old multi-level marketing system. Okay, so if I'm going to really love on 5 or 6 and they're going to love on 5 or 6 so that's how we've grown it. What I'm anxious for someday with AI, because we have several different systems. So we have our billing system, we have our documentation system, we have our accounting system, we have our relationship management system for marketing, and we have a system that graphs and looks at our metrics. I'm waiting for AI to be able to look at all that where I can just open the computer, say, okay, I want to know these key performance indicators for each therapist, for each office over the course of the last 6 weeks, and boom, it'll pop up a graph. Right now, at each quarter, each year, I have to kind of go, okay, where's this? This one's here. This one's here. How do we pull the financial part into it? They each kind of do a little bit of it, but they don't always quite match. So you got to do a little bit of interpretation. So getting that system where AI can look at each of those and give me the metrics so that I'm saving time doing that. And then I can spend more time building the relationships. So that's what I'm excited.
So getting them all to talk together.
Yes.
Yeah.
I mean, I look at Star Trek, Geordi LaForge can be 10 light years away. He gets on this alien ship that's been sitting there for 100 years. Within 10 minutes, he's got the computers talking to each other.
Yeah, I love it. Absolutely.
I can't get my QuickBooks to talk to my web PT.
So Jeff, how can people connect with you and learn more about Petersen Physical Therapy?
The easiest place is our website, which is basically petersenpt.com, all ease.
Amazing. So petersenpt.com.
Correct.
Can we find you on social?
Yes, we're same thing. I don't know what our Instagram or I think our Facebook page is also Petersen PT.
Okay.
And there's a Petersen PT YouTube page that has probably, I don't know, a few hundred videos on specifics, shoulder pain, neck pain, TMJ.
Yeah.
That's where we offer the specific tips on how to deal with those things.
No, YouTube is a great place for you to be. So definitely for those of you listening, if you're watching us on YouTube, go to the web, go to the YouTube page, go check it out and go learn, and go to Petersen Physical Therapy. No, petersenpt.com. We
Correct.
will have all of Jeff's social media links in the show notes. So you can go search for him or just go to the show notes and grab the links and go connect. He's pretty awesome, as you've heard here today. So you definitely want to reach out to him. Also, go grab the book. Depending on when we're airing this, you want to definitely go grab the book. If it's live and dropped by the time we air this, we will have that in the show notes as well. If not, go to petersenpt.com and go check out. I'm sure he'll have information on there, or just reach out to Jeff personally, but go search for the book and go grab it. Jeff, can you tell us again the name of it? I'm looking for my notes.
Shadow of Pain.
Shadow of Pain. It sounds very interesting, and you definitely want to grab the book. I'll be grabbing it. So if you're listening, if you're watching us on YouTube and you know of somebody that you know would benefit from this conversation, please share this with them. Let them know about Jeff, about the book Shadow of Pain. And because we want to support our guests here, the goal of this podcast and the reason we created it was because 90% of businesses fail within the first 5 years. And our goal is to flip that number. And our guests, including Jeff, are here to share with you what's worked for them, what they've done, what's worked, what hasn't worked. When he started, he was pounding the pavement, yellow pages, making those phone calls. I was just talking to someone today going, the way we did business in the past is now coming back to the way we're doing business nowadays. It's the whole hustle culture of being online and throwing content out there and getting in front of people isn't working by itself anymore, especially with the evolution of AI. So AI is great for efficiency, but AI is also bringing to the forefront and making the relationship and communication and that interpersonal relationships more and more important. So if you know of anybody that would benefit from hearing this conversation, please share it. Also, if you are listening to us on your favorite podcast platform, thank you. If you know of anybody that would benefit from this conversation, please share this episode with them, introduce them to Jeff, and let them know he's here, and let them know about the book Shadow of Pain. Jeff, before I let you go and wrap up, is there anything that you'd like to share or say that I didn't ask you or we didn't touch on today?
You're awesome. That's all I would say. You're doing a great job. I appreciate all the kind words, and I love your enthusiasm.
Oh, thank you. I'm excited to have you here. My
Yeah.
daughter's been going through a lot of back pain since she's 17. She was an ice skater and she complains to me all the time, and I feel helpless. So I appreciate you being here and you sharing your expertise and wisdom with us, because now I know I can, a little more on how I can support her. And I will talk to you offline on maybe some ways, because that's one thing, like you mentioned it, people don't know where to go to support pain.
Yes.
So you being here and getting on podcasts and sharing your wisdom is greatly appreciated.
Awesome.
So keep doing what you're doing.
Well, thank you.
Yeah. So thank you all for listening to us on the Business Growth Spotlight. Go connect with Jeff. Go get the book, Shadow of Pain. And I look forward to seeing you on the next episode of the Business Growth Spotlights.